when someone has a prolapse cord, which position do you think is more better for you to teach the patient to assume? Someone with a prolapse cord.
New chest position.
Chest position. Chest position is wrong. Oh.
Chest. New chest position.
Knee chest.
Yes.
Yeah, knee chest position or Trendelenburg position. So if you don't see any of them, okay, they are wrong. There is no way you can see these two things all at once. You should see one. Okay. All right. Now, after lumbar puncture, when I put a patient in a prone position, am I correct or I'm wrong?
You are wrong.
You're correct.
That's correct.
You are
Am I
wrong.
correct? Am I correct or I'm wrong?
You are wrong.
Hey.
I feel like you're correct. You can put in supine prone.
Okay, so most of the times we normally say that after collection of CSF, okay, that is after lumbar puncture, we should make the person lie flat. Don't we say that?
Yes.
We say that. So is prone position not flat? The question is prone
on the back.
good. So when you see what the questions you get on the NCLEX will not be difficult, but very tricky. And this is one of those things. Most of us know or we've read from our notes that you should assume flat position. And there are a lot of books which normally chooses the supine, but the ideal thing is flat. So when you go to the NCLEX and you don't see supine position and you see prone, then some other positions, prone is better because it is so flat. Okay. I hope we all agree, right? All right. Then the last thing, so that we continue. The last thing. When someone has gone for craniotomy surgery, which position do you think we should put the person?
Low Fowlis.
You said Fowlis.
Low Fowler's
Low.
position.
Low
30
Fowlis,
degrees.
okay. 30
Right.
degrees. 30 degrees. 30 degrees. Good. Maybe last one. Sorry, last one. So an infant with spinal bifida. Which position?
You put on prone position with the head tilted to the side.
Prone.
So why prone position?
Because you don't want to cause trauma on the spinal exposed spinal cord.
Okay. 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 All right. I think we should continue. We should continue from where we left. Right. We fall downward. Okay. Let me check something. Where did we end?
Hello, yeah.
So
Yeah.
hello, yes, you can talk.
The position that they give the answer for low Fowler's, was of which condition did they mention low Fowler's?
Brain injury or craniotomy. Do you get it?
Yes, thank you.
Okay, you're welcome. Let's see. Please, did we do this question? Kindly help me, okay? Track it from where we ended. Did we do this question? because we had some few questions before we were supposed to do disaster management. We did not do disaster management in prioritization. So that's the last, oh, we did it. Did we do it?
No,
Hello.
we did not do this.
We did not do the disaster management, right?
Yes, we did not.
Okay. You let us pick it up from here. Okay. So you have a clinic nurse who receives phone call about the following 4 clients. Which call should the nurse return first? So if you can help us with it, then you raise up your hand so that you'll be called. Some of us are choosing 4.
Oh, yeah.
So any reason for that?
So, the symptom says red and itchy and have a yellow discharge. With red and itchy, it can be allergy or something. So you need to attend to the person first.
Please, do we all agree? Or are we going by the principle we all fall together and we all rise together? Okay. Let us see. But why do you think one is wrong?
One is wrong because it's normal. If you have this vaccine, obviously your temperature will increase.
Okay. 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 I'm coming. Okay. I want all of us to look at the thing critically. Okay, what do you think option 2, then 3? Let's look at 2 first. What do you think of option 2? Why do you think it's wrong? I think we have a hand up here. Oh, the hand is down again. Who can help us with that? Why is the option 2 wrong? Then why is option 3 wrong? Let me mention a name, maybe. It's a Charity. Do you want to help us? It's a Charity, you're muted. Do you want to help us? Okay. Okay, Mr. Will, let's go.
Okay, for me, with the 2, it doesn't state any specific findings, which is, which is so much severe that needs to be addressed. Because this child, obviously, he can wait for maybe a couple of minutes. Whereas the 4, I think the red and itchy with yellowish discharge, to me, is really severe for me.
Okay. Can you help us with the 3 too? What is happening there?
Oh, with the 3, deep breathing with chest pain is normal. With pneumonia, it could be one of the signs and symptoms, which is normal. So yeah.
Okay, so look at option 4 again, the option 4 that you agreed to. Look at option 4 again. What condition can you suspect? Not a confirmatory diagnosis, but what condition can you suspect here?
Conjunctivitis.
Viral conjunctivitis.
Viral.
Okay, so it could be maybe viral or bacterial, no problem. But it's conjunctivitis. It's a good guess. Okay, it's a good guess. So it's a very good guess. So per how you are making the deductions, okay, this is the reason why we are doing prioritization together so that we can all reason out on the question, okay, together. Now let's see. You see, Mr. Will, you see how you deduce the option 3. It says someone with what? Lung pneumonia can definitely have chest pain and what? Abnormal breathing, which is normal towards the pneumonia, right?
Exactly.
Now you've been able to make a right diagnosis of conjunctivitis, a suspected one. Conjunctivitis, won't they have red eyes and itchy and to yellow discharge? Won't they have? Or there's something here which is not expected of conjunctivitis. Is there any?
I think they are all expected.
So why do you become biased in your question? Or because you saw the red and itchy? Something which is itchy is worse. Okay, so fine. Let us look at the option 1 again and see. A 6-month-old who received some vaccines, okay, 18 hours ago and developed fever. We all know that some children, okay, some infants, when they get these vaccines, they have high temperature within, is it up to 24 hours, right? Within the first 24 hours, they can have some high temperatures which should go down. Our pediatricians, I think you are all here. Our pediatricians here for I think 24 hours, right? It is not compulsory for them to have, but some might have these high temperatures. So it is also normal. Let's look at option 2. You have 11-month-old with unconsolable cry. So the cry is unconsolable. No matter what you do, the child is crying. And look at this one. At least, even if this one is okay, look at this. Look at the second part of the question. Drawing up legs towards the abdomen.
That child is in pain.
So it means something is happening in the abdomen. Between this
Yeah.
one and conjunctivitis, which one will you choose?
We choose the two because the infant is guarding the abdomen. So definitely, I suspect the finish.
The infant cannot tell you I'm having pain in the abdomen, but only demonstrate through signs. Please, you get the whole picture. You see how it is. So when you get prioritization questions, please take your time and look at it well. They are very tricky. Even for most of us, sometimes we get some prioritization questions, we see some somewhere, and we all have to struggle. Okay, it's normal, but at least there are a lot of things you should be more preview to. Okay, as soon as you see them, I mean, you should just see them. Shouldn't be any big deal. So you chose your option 4. I choose option 2. Do you agree with me? Will you throw away your option 4 and
Yes.
follow me? Okay, so let us look at the answer. Please, the rationale teaches lots of things, okay? So let us look at the rationale very well. Can we move on?
Yes.
No,
Okay.
please.
So even the wrong answers for the wrong answers here, there are some things that you can pick them up. Okay. So that's why you see them elsewhere. You can be able to look at them. So you see, like the kind of stool that someone with interception should give you. So you can search for how current jelly stools look like. Okay. Into all right. So I think we should move on to the next one. Okay, so this will be the last aspect of what we look at on prioritization. Then after, we'll try our hands on some few general ones. Okay. Then we want to prioritization in disaster. What we are saying is that if there happens to be a disaster in town, and if you have to discharge someone, who do you discharge? Sometimes you see there could be a question where there's a disaster and we want to make room. Hey, are you talking to us? So there might be a disaster, okay, in a town, and maybe we might be forced to make room to take those who are severely injured. Okay, we might be forced to make room for those who are severely injured. So when you get questions like that, and they ask you, which ones should the nurse trans out, okay, or transfer or discharge? What it means is that you have to look for options that mentions a patient who is stable among the list given, okay, because we want to make room for people who are severely injured. Every patient is equally important, and you can't neglect someone who has equally serious issues. So you only transfer or transfer those or discharge. Sometimes the question will use discharge. You only discharge those who, or yes, let me say that somewhat stable conditions, so that you make room for those who are not stable. And when you are doing that, what you are saying is that age is not relevant. Okay, age is not relevant. So you can't say maybe this person is 89 years old, so we will have to clear him or her and make room for someone who is 12 years old. It is it's not ethical. Okay. Okay. Then the next one, you can't say this person is a male or a female. So you have to discharge the person and make room for some other. That is also irrelevant. Then the diagnosis, okay. Then you ask yourself, what do they have? So when it comes to discharge or something, always acute beats chronic. This isn't the first time you are seeing this. So if the person has chronic condition, person can make room for someone with acute condition. Then sometimes you have to look at the modified phrase, okay, what they are doing. So they can give you a condition where they will tell you, patients, let us use the question we did before. Okay, let me use this one as an example. You see, if the question had mentioned, if you're looking on the screen, if the question had mentioned that this option 3, let's say a 4-year-old diagnosed with right lung pneumonia 2 days ago, who has chest pain when breathing. If, let's say, the sentence was has increasing chest pain, okay, or who is currently experiencing something that shows that that thing is ongoing, okay, or it is worsening. I mean, it is happening, it is worsening. You know, when you have this pneumonia, because of persistent cough and those things, you can have maybe chest pain, a sustained one. That is okay. But if they had mentioned that the breathing, or let's say the abnormal breathing pattern is worsening, something ongoing, then this one would have been prioritized. Okay. This one would have been prioritized. So, Nanama, you're right. Hey, who is that? Violet. Violet Candy. Nanama, you're writing on my screen. Okay. So
Sorry.
let's go. Okay. All right. So that is a summary of the prioritization, how to prioritize in disaster management. And let me give you some another way of this disaster management prioritization. I think I didn't include it here, but there are some questions. There are some questions. What happens is that they will ask you which kind of patient should we make room for? There are two things. So, which patients should we discharge to make room for someone who is coming? The concentration is among those who are a bit stable and already there in the hospital. But when they ask you that which patient should we make room for? When the question says this, it means the question is referring to those coming. So you'll have to prioritize them too. Okay. And you use similar pattern as we described. Now, you ask yourself in triaging, you ask yourself, you know, we have the color codings. When someone is red means emergent, okay, or it's emergency. When someone has a black, then you know that you don't have to waste time on it. So what I will advise is that sometimes open your eyes. With the black ones, they will mention it in a way, or they will describe it in a way that you can't even spot, or you might miss unless you know what you are doing. Okay. One famous example I normally use is the Benz one. When someone has 80% going, even if the person eyes are open, the person is conscious, you don't have to waste your time. If you know definitely, if the question mentions 80% or more of Benz, and someone is having, let's say, a severed artery where the person is throwing away blood, okay? I mean, blood is gushing out. You know, you have to save this. But even if, let's say, if the Benz patient, maybe this example, how I've cited it will be easier for you to choose. But let's say someone who has Benz and has airway issue, okay? Someone who has Benz, like 80% Benz and has airway issue, and someone who has no Benz, but with only a major artery which has been severed and throwing away, I mean, blood. Which one will you prioritize over the other? Don't go and say because the person is having 80% Benz and the person is having maybe a compromised airway. And according to your ABC, you have to prioritize airway too first. And even in that patient, Benz has even added on to her complications. So you choose that one over someone who has a severe artery, maybe major artery. Okay. So right away, those people are called black. They now come to those who you think they have chance of surviving. Because when you waste time on the one who has code black, by the time you take a look or you have time for the one who had that severe artery, that person too might have gone, because bleeding or an oozing artery will not wait for you, and an oozing artery will not clot. It's not like from a venous, and even if it's from a venous source, it depends on how bigger the vessel is. Okay, from an artery, you need pressure and with right management. Okay. So that is what you're trying to see. If you have any question or maybe something to add up, you can let us know. Okay, if there is nothing, then let us move on and see what we have here. Let's look at this question. The nurse is the first responder. The nurse is the first responder after a tornado has destroyed many homes in the community. Which victim should the nurse attend to first? Who can try? If you want to try, you can raise up your hand. Who wants to try? You can raise up your hand. Okay, Sister Gloria, let's go. Your hand is up.
So number one, if the baby is not moving and there's a likelihood of the woman losing the baby, you can't do much about it. So you have to forget about that one. Then number two, the child is bleeding, and the likelihood of the child losing a lot of blood going to hypovolemic shock is high. So you have to attend to that child. Number three, the child is standing by the family member. So this one, you really don't have to worry yourself much about. The family member will take care of the child. Then the number four, the husband is already dead. So this one, the person needs psychological support. But there is a client who is bleeding, so you have to attend to the bleeding case. Thank you.
So you will choose to?
Yes, I'm choosing.
Okay, very interesting. Sister Letitia, your hand is up. Let's go.
Okay. For me, I'll go for two because the first one says that the mother who is pregnant shouting baby is not moving. At that moment, nothing at that instant. You can't, even in the tornado, assessing for even the sound and whatever is going to be another whole lot. Meanwhile, there is someone who is bleeding profusely and needed to be attended to. So to prevent that child going into shock, to me, that one comes first before the woman shouting that baby is not moving. Then the three, mother, child standing by family member. There's not nothing much to worry about because it's a disaster and everyone is worried about who they care. Then the question four, the husband is already dead, which of course is the black, and nothing much needs to be done than the psychological support. So I will choose to.
Okay. So we have two people choosing to. I think it makes. Please, if you have any different option, you can bring it out. If you think it's not true. Okay. So the answer is two. You are all correct. And that is the rationale. So I like how you deduce it. So it is my prayer that as we end it today, at least your prioritization skills will improve. Okay. And those of you who have been following since the first one up to now, I don't know if you've tried some personally. Have you seen any slightest change? Even if not big, have you seen any slight change? Anyone to let us know over here? Have you realized any slightest change in our prioritization or generally in our question answering skills? You know, there are some of them you can relate. Okay, with the same principle, we can relate to general English questions. Is there anyone here too? Or we've not been practicing? Is there anyone here? Okay. All right. Let's look at another one. The nurse in the hospital emergency department is notified by emergency medical services that several victims who survived a plane crash will be transported to the hospital. Victims are suffering from cold exposure because the plane plummeted and was submerged. Was submerged in a local river. What is the initial action of the nurse? But I think this is also the best time to mention. But let me test you first. What do you think? Who can help? So Letitia.
My view on this, I must say, let me put it short. I'll go for 4 per my view, because in the statement it says that
Hello.
Yes, I said per my view, the plane got merged in the local water. So the people are cold. Then they will need warm to prevent them from going into shock. Since the internal organs, I think the body's temperature has been altered. We are warm, and I think how do you say, the temperature have to be kept at a particular range. So if it goes below what it should be, then the body organs will be in danger. So for me, the immediate action. Okay.
Please, can I say, I want to contribute, please, if she's done.
Okay, let's answer.
Hello. Please, can you hear me?
Yes.
Right. Sorry. Okay, my network took me off. Oh. Sorry. So Letitia, you were saying something.
Yes, so I was saying something, but I changed my mind.
Oh.
Looking at the initial action.
So which one will you choose right now?
I'll go for 1, since it's not one person, so that there will be more hands to help. Before
Okay.
I'll think of keeping them warm with the warm blanket to prevent shock.
Okay, thank you. Could you?
You want
Brother
rice?
Kojo.
Okay. Sir, I'll go for one because all the answers apart from one, they are embroidered in one.
Okay.
Yeah, you activating the emergency disaster plan. It includes a lot of things, and 2, 3, 4, and 5 are all included in one. You just activate and everybody gets ready. Whatever needs to be done has to be done before the patients arrive or something.
Okay.
Including,
Thank you.
yeah.
Thank you. Takujimi, are you going to say the same thing?
Yes, I was going to say the same thing.
Okay, thank you. So I think we all get the clue now. So the answer is 1. In any form of disaster, activation of the disaster plan is the first thing to do. It's very necessary. Okay, so that's like our brother said. The disaster plan is well structured. We all know what to do, where to assemble, how to go about everything. I mean, it's well structured and it's better than doing anything. Okay. All right.
Question.
All right, you can ask a question.
Right, I don't doubt the answer, please. But my
Mhm.
question is, why won't the nurse activate this disaster or the emergency sort of bell all by herself rather than calling the supervisor to do it?
Okay. Who can help answer that? Who can relate? Oh, I think this one should be very easy. The question he
I
asked.
think if I should speak, yeah, sorry, I didn't raise my hand. I think
No problem.
you are not the final person to take the decision for the unit or the hospital. If you might have the chance to get hold of the phone, but the next thing you have to do is to inform your nurse in charge. You cannot just take a decision that I'm activating them because I received the call. If you receive the call, whatever you were told, you have to inform the nurse in charge, even though you may be right to activate the emergency disaster plan, but you have to inform your nurse in charge. I think it's in the right direction. And it wouldn't take any minutes or hours to do that.
All right, thank you. I'm happy.
Yeah.
Yeah, just dealing with ranking. I mean,
Yes.
just junior reporting to the superior. Okay.
Yeah.
Thank you.
Okay. There's another thing here too. Okay. Apart from that, there's another thing here too. Apart from the ranking aspect, this aspect is also fine. Okay. I mean, activation of the disaster plan. Okay. And that should come first too. So even if it wasn't a nursing supervisor here and it was even only this one, I still think this one should go first. Please, you all agree with me?
Oh yes, for the answer, it's
Uh-huh.
perfectly right. I don't doubt the answer. I know it, and I just
Oh,
wanted
you're
to find
interested in
out
the
why.
person there?
Yes, just the person, because I
Okay.
feel, because for instance, in my unit, if I face a challenge or if anything of that sort come, I stand in a position. So long as I'm registered, I can activate the emergency. It doesn't have to be, because we even assume you going to inform. But well, I think with this particular one, there was time enough for the nurse to, yes, inform the superior to do it. But I mean, in a situation where you don't have time, we assume going to tell the supervisor would even delay. Yes. So it's always good to activate it yourself. But for this one, we could buy time. So I'm happy. Thank you.
Okay, you're welcome. Thank you too. Let's kill this one to right faster. You have a nurse who is the first responder at the scene of a 6-car crash on the highway. Which victim should the nurse attend to first? This one is easier. Anyone who spends more than 30 seconds on this question. Till the person has a lot of work.
Three.
Two.
Three.
Two.
Hey, that's true.
One.
One.
Hey,
Two.
it's very
Hey.
simple, but we have three options. Someone is saying A. You sit there.
Oh,
Two.
It's very confusing, eh? Very simple too. Okay, let me pick those who sense are up.
one.
If you want to answer, raise up your hand, okay? Brakojo, is it an old hand or a new one?
It's old and new. It's new. I'll choose two.
Hey, someone, Alima to
Hey,
kindly.
sorry.
Your kids are disturbing you, eh? Okay, so you said two, eh?
Yes, sir.
Okay, let's listen to Takujimi and then after Sullivan.
Okay, so when you explain prioritization based on the body systems, so you are talking about the the brain comes first, then followed by the lungs, then followed by the heart, and then that order. So I think that the victim with experiencing confusion, it has to do with the brain. So that's why I'll give it a top priority, then followed by the person with the lung problem experiencing dyspnea. Then the heart comes after, that's the third. And then the last is the fourth. So that's my rationale.
Yeah, okay. You are correct though. You are correct though, but let's listen to Sullivan. You look at the answer very soon. Sullivan.
Thank you. I'll choose a victim experiencing dyspnea because airway should always be a priority according to me. So we can easily lose a patient who is having dyspnea than a patient who is having confusion. Thank you.
Okay. Thank you too. All right. So let me prioritization is a bit dicey. That's why if you don't practice, you not become perfect. But let's see something. Let's pick it up from what Takujimi said. You know, when it comes to organ prioritization, if only the brain is at fault, okay, or the brain is there's something happening to the brain, and we are very clear, the brain will come first, okay, when it comes to organ prioritization, before you even come to the airway, before you come to even the heart, the airway, and the airway and the lungs, okay, and the rest will follow. It is true. But you see, when you have a condition whereby in that condition the person is experiencing dyspnea, even if the dyspnea is increasing, okay, let me leave that aspect. Let me just touch simply on this one so that we move on. We are saying a victim experiencing dyspnea and a victim experiencing confusion. So when it comes to, and let us look at what's happened here to these victims. They had a car crash, right? They had a car crash. So after a car crash, but please, I hope you all bear with me and you understand that this one should be ruled out. Are you all accepting that fact? So that we prioritize this. So I think that the main one or the controversy is between these two. Am I correct?
Yes.
All right. So let's look at this thing. Does confusion emphasizes, okay, the person had car crash too, but someone who is experiencing confusion, does confusion has something to do with level of consciousness? I just want to rule it out and see. Does it have something to do with level of consciousness?
Yes.
Yes.
How is it related?
So we assume, oh, sorry, should have raised my hand first.
No. Carry on. No.
Right, so we assume confusion could be related to the brain because in assessing a brain damage or people could have an early stage of further problem in relation to the brain, which would always start with confusion and then possibly follow with other symptoms. So I believe confusion has something in relation to the CNS, which is in the brain.
Okay. There's
Okay,
no.
so can I try?
Okay, you come in before. Yes, you can try.
Okay, so when someone is conscious, in a normal circumstance, we expect the person to be oriented. Yeah. So if you are confused, if you are conscious and you are not oriented, though you are conscious and you are not oriented, we take it as maybe you are confused. So confusion in this has something to do with your level of consciousness.
Okay. Okay, thank you. Okay, so let me mention this. Okay. We have, in this case, this kind of brain injury could be traumatic brain injury. Okay. But let us look at something. I want us to do some comparison. When someone has this traumatic brain injury, if you want to see how serious the injury to the brain is involved, or it's linked up, one, level of consciousness. Okay, that is part. Then we have, okay, you can have maybe coordination problems, okay, and speaking problem. There could be confusion too. Good, like you said, confusion is there too. But let's say you have an accident within the scene. Someone just has confusion, okay. The person didn't say that the person has difficulty breathing, but only just confusion. And you have someone experiencing dyspnea. So between the difficulty breathing and the confusion, between the two, just on the side or on the site, okay, or at the scene, I want you to look at it exactly as the question says. Which one will you go for first? Or it's still the same?
Someone with difficulties breathing.
Yes, for me in this case, I wish I could see where the brain. I think we have when we move ahead, we have questions where the brain aspect will come. Then maybe we can see how it is. Violet, you want to say something there?
I will go for the one with the difficulty in breathing, the one who is having the dyspnea.
Okay. For this one too, for me, I think difficulty breathing should come. Confusion is a sign of brain involvement. That one, there is no doubt. But if the question had oh my mouse. So if the person had maybe changed this one, this one is an issue though. But if this one happened to be level of consciousness, do you know when they tell you maybe decreased level of consciousness or something like that, it means one, you see, when someone has a low level of consciousness, the person's airway is also not protected. Okay, and the brain is also involved. So that one will take a priority over the dyspnea, but just confusion. Okay, someone with confusion, for me, I think the person can breathe normally. So, it can even be a lucid period of, yes, there could be a possible traumatic brain injury, but it could be maybe a lucid period of something. of the brain injury.
Um,
But
sir,
just confusion.
Please, I wish to
wait,
ask a question.
wait,
I
you come
wish
in. Let
we
me
could
land.
look
Let
into
me
this,
land.
please.
Let me land. Okay, then you can come in. So if, let's say, this one had been low level of consciousness, okay, I would have chosen that one over dyspnea, because low level of consciousness will have issues with respiration too, and the person cannot control their weight. But just confusion and dyspnea upon an accident scene, I'll choose this one. So now you can talk. I think, okay, you come in first. Wait, so let me ask, Sullivan and Gloria, are they good hands? Mr. Entry, you can talk.
Yes, boss. I think I've had a personal experience with this situation, and that's why I would always want to go for confusion. So what happened was it was an RTE, and then this man came with another person. The person was in dyspnea, as we say, and then he was confused. But I mean, he could just be speaking about and then walking up and down, thinking he was okay. The next second, it was actually a rupture in the vessels with the brain. So there was edematous and a whole lot of activities which went on after bleeding in the cerebral cavity. So what happened was we lost this man just some few minutes trying to stabilize the one with dyspnea. He just went like that. He went. So
Okay.
I'm talking with
with
the experience
yes.
I've had.
Yes.
So the confusion
okay,
could we could score the GCS.
Okay, so wait. Yeah, it's even better. You are even saying what I want to ask you. So
Okay.
wait, what is GCS used to measure?
So to measure the
level of consciousness.
Level of consciousness. But confusion is an aspect of consciousness level, please.
Good. But the level of consciousness is a full package. Confusion is only one part. That is my argument. Confusion is only one part.
Clear.
You
but
see,
you know,
wait.
it will definitely start with the confusion before person loses consciousness.
Good.
So why not make this one as a starting point of losing consciousness?
So wait, I understand your points. All right, okay. Let me talk about your case, the experience. The person had, it started from somewhere. When the person, when you realize the person was having a ruptured vessel in there.
It was actually after. I'm sorry.
Okay, before you realize, the person's level of consciousness was decreasing before you realize, right?
Right. So, like I said, it started with confusion, and
somewhere.
then he could not be precise with the time, and then was
good. So it starts from somewhere. So you see, what we are talking about now here is actual. What is actually going on currently? Okay, we have some of the prioritization questions. If let's say all of them are talking about maybe what could possibly happening. So what could possibly happen next or maybe in the nearest future, then you can look at what to prioritize. But this one, you're looking at actual, what is really happening. Okay, that's why I stated that in this particular question, if they had mentioned decreased level of consciousness here, I would have gone for this one and leave this one. Confusion is also a start of it. Okay, it could be a start of brain injury, but we are looking at what is currently going on. You know, confusion too can also be just a lucid period. Maybe it could be just a temporary something.
You're right, though.
It could be both. I mean, a start of a serious brain injury, or it could be a minor something, maybe a lucid period, something small, that it will go away. But you let us take it as the question says, it's confusion. It could be a start of brain something. But we are in the confusion stage compared to someone who is experiencing dyspnea. These two of them, which one will you get time to save? Let me say that. Which one will you get time?
All right, you are right. I'll go with dyspnea because it could also be a whole lot of things going on.
You see,
Fractured,
but if good, but if but if the level of consciousness has been stated that it is low, that one will be prioritized over this one, because if the question says this one has low level of consciousness, it means already the person can't control the airway.
I'm okay, boss.
And the whole lot.
Let's move more. Yeah.
Do you understand the
convinced. I'm
concept?
convinced. Yes.
It's a tight something, but well,
Decision to make. Yeah, I'm convinced anyway.
Okay.
Thank you.
All right. You're welcome. So you see. So I think this one has even a short something. So let's move on to the next thing. See. The nurse from a medical unit is called to assist with care for clients coming into the hospital emergency department during an external disaster. Using using principles of triage during a disaster, the nurse should attend to the client with which problem first. This one is easier. For this one, if you answer it silently and wrongly, it is over to you. This one, let us all even say it. Which one do you think would be the answer?
Four.
A. Are you sure? Are you sure?
3. I'll go in for 3.
Okay, so wait, let us triage these clients. Okay. Okay, let us rule some of them out. Someone with fractured tibia.
2.
I think it can easily be ruled out. Someone with a penetrating abdominal injury.
Yeah, that also seems
This one
multiple
is there.
organs there.
And someone with a bright red bleeding from the neck, from a neck wound. This one. Okay, so wait, let me ask you between even these two. But this one, let's rule it out. I think you all agree. Between 2 and 3. So you see, let us reason together and see what we can deduce. Okay. This one has just a penetrating. I mean, I shouldn't have just. I mean, this one has a penetrating. Yes, I have retracted my words. So this one has a penetrating wound. Okay. And this one has bright red. So let me also use just for this one too. Just a bright red bleeding from the neck wound. You know, you have 2 major. I don't know whether they are by anatomy. I don't know whether they are other.
The first one, 2 is a cavity, and 3 is the neck. I don't know. It's not a cavity.
From a direct artery source.
Okay, that's what you mean.
Okay.
3 is from a direct artery source. Yes, please.
So it is this one that gives the clue. Okay.
Yeah.
The bright red bleeding. And like I'm trying to say, I think we have, if I can remember my anatomy well, we have 2 major arteries. They lie side by side the neck, then they supply the brain. You remember? That is where, if you want to feel your carotid artery, you know, I think they lie side to side and separated by the trachea. I mean, around where you have your voice box. You see, when you're feeling, you are palpating for carotid artery. You see, you have one here. So that is what they are trying to say. So if you have bright red bleeding from a neck wound and you have penetrating abdominal injury. Okay, so let's prioritize these ones before we even add this one. These two. So you ask yourself, It's not about which one is serious. So ask yourself, which one will you also get time? Please, so let us get the trick. Apart from its seriousness, sometimes if you have difficulty in choosing between two answers, ask yourself, which one won't give you time? Ask yourself this question, which one won't give you time to treat? So between the two, which one won't give you time?
Three.
So you see how you prioritize. Okay, sometimes someone can have abdominal injury. It could be very, very serious, but the person can be able to reach the hospital. Maybe the person might be late, but comparing 2 to 3, there is no time for 3. Okay, compared to 2. Okay, fine. So between 2 and 3, we choose 3, right? Now let's compare 3 to 2, 4, and see. Which one can we prioritize?
To be fair, it's still 3. Because
so open massive head injury.
Massive,
so
the adjective there.
So what code will you give to this? The color
Black.
code.
Black.
This is black.
Yeah.
Black.
Okay.
Black.
The person is dead. Okay. So the answer is 3. You see how interesting this can be? Some of us were mentioning 2, 3, 4, and the rest.
Okay, so boss, you said always black could, be seen as someone who is almost vegetable. Yeah.
Oh yeah, straight away.
Okay.
Yeah.
Right. These are tricky.
Okay, so we have a rationale. Let us look at the rationale. Let us look at the rationale and move on. It will get better. I mean, that's how sometimes prioritization is. It will get better. Please, can we move on? Let's look at this one too. Zoom user, please change your original name, okay? Let's continue. Which clients should the emergency department's triage nurse classify as emergent? Shafao, your hand is up.
Yes, please. Sorry for sending you back. It's still in confusion. I don't know which answer was the final answer.
Shafao, your hand is up. You can unmute and talk to us.
Yeah, I'm talking. I'm saying with the deep still in confusion. Which one did you pick?
Come again.
What was the con? Which the previous question? We're dealing on Disney and confusion, so I was locked out. So I'm just asking which one.
Hello.
You think? Can someone kindly tell him what I'm saying?
It was the shortness of breath that we picked. Dyspnea.
Okay, thank you very much.
We chose dyspnea. Can you hear me?
Yeah, I've had it. Thank you. Thank you.
Hey, my network took me off again. It's serious. All right.
Somebody saying so black code.
Please, I hope you can hear me now, right?
Coming.
Hello. Please, can you hear me? If you can hear me, okay. Can you hear me?
Yes.
Yes, boss.
We can hear you.
Okay, so let's continue.
Okay. Hi, sir. Good evening. Hello.
Yes. Please, can you hear me now? I think my network has been disturbing me. Good evening. Can you hear me?
Yes, I can.
All right.
Please, somebody is asking a question, and the said black coding. I didn't hear anything again. If the person can come again, please.
Yes, I asked if the black code is given. It literally means the person is vegetable. I mean, dead and gone. We barely could do much to help. And then he said yes.
Okay.
Okay. Please, I hope it's fine now, right?
Yes, please. Thank you.
Okay,
Hello,
you're welcome.
sir.
Yes.
Okay.
That is
Please,
Mabel, Mr. Mabel.
yes, please.
Mm-hmm.
Please, with the triaging, the black code, you were like, we shouldn't waste time. We shouldn't waste enough time. Is it that we shouldn't waste enough time attending to them, or we shouldn't attend to them at all?
Mm-hmm.
I don't know.
That should be your last option.
Okay. Okay. Thank you very much.
Don't attend to them at all. Yes, they're the least priority. You're welcome. Okay, so we can put our hands down now if it is not an active hand. Okay. So let's look at this question too. Please bear with me, okay? The network, we've been having challenges since. So bear with me. If it gets your point, you can't hear, you let me know. Which client should the emergency department triage nurse classify as emergent? So among these four, which one do we think should have the priority? And you tell us why. Please, if you are here and you are looking at it and you're not trying some, you're not doing yourself any good, okay? This is the time, we are spending time, we are spending money, and at the end of the day, these are some of the things that will be asked. So try, even in your tight corner, try and do some, okay? Do not let people do, and just remain silent and we move on. Try and do some, because when you take part actively, for prioritization, it's more of practice. That is the only way you can understand it well. So what are we choosing?
3.
Option 3. Who said 3? Can you tell us why? Or what you suspect?
For charity, I chose 3 because of airway. I prioritized because shortness of breath. It shows there is lack of airway blockage, maybe.
The explanation is becoming a challenge. It will get better. Yeah, I understand. All right. Who else wants to try?
Please, can I try?
Yes, you can show by your hand, okay? Just raise your hand here.
Okay.
If you want to talk, you can raise up your hand. Okay, Takujimi.
Okay, so I'll take option 3 because I know that chest pain, especially they describe it as a crushing sustainer pain. If it's crushing, that means it's very severe. So our chest pain is always an emergency.
Okay. Okay.
You always put it as emergent.
Okay.
So that's why I'll take option 3.
And it also depends on
the airway too. So yeah.
Good. So it also depends on the options that come with it. Okay. So that you know which one to prioritize over the other. Yeah, so you've done well. You've done well. I think we should move. What's Letitia? Your hand was up to.
Oh, I
So
think it's the same thing. It could be a broken ribs or something piercing in the chest. So it needed to be
okay.
attended. Yeah.
Okay, thank you. It's Emilia.
Yeah, I also wanted to talk about the cracking, that's the modifying treatment. So I think that's what happening now.
I think we can't hear you well. Oh. Maybe your earpiece or something. Oh. Am I the only person who can't hear well? It's Emilia, please, if you can come again.
Yeah, I said
Uh-huh.
I think that I also wanted to highlight on the crashing sustainer thing and the raising and the modifying reason why.
Oh, okay. Okay. Okay.
Yeah.
All right. Thank you very much. Thank you very much. So I think let me see what we have. Okay, so I think that is all that we have for now on the disaster management. Okay. So before we throw everything away on prioritization, there are some few questions here for us. Okay, about should I say about 15 or 20 questions generally. So let us round it up with them. This one, it comes from all angles, okay? Different types of prioritization questions you can get and the rest. So let us deduce the action, the answers together. Let's try and involve ourselves fully. Maybe it is the time for you to understand prioritization and better it more. So let us all get involved, okay? So now generally, the first one, a 16-year-old patient with cystic fibrosis. So to understand everything better and to also remind you, remember we said, apart from looking out for the tricks in prioritization, you should also know the condition that is being spoken about. So you remember the first day we did prioritization, we said content is also part of it. Because if a condition is mentioned and you don't know what it means, okay, let's say someone with maybe rhabdomyolysis or no, it's even, let me say someone with this condition. I want to remember this condition. Oh, let's say neuroleptic malignant syndrome. Okay, and having maybe issues with okay, I think when they even add the kidney issues and the rest, you even get to know. But when they mention something like neuroleptic malignant syndrome, you know it's an emergency. Okay. And what is the other one? There's another. Is it something like hyperthermia? Who can remind me?
Malignant hypertension.
Malignant, good. Malignant hyperthermia. These two ones or these two conditions, they are emergencies. Okay. As we learned the other day that diabetic ketoacidosis (DK) is also an emergency in type 1 diabetes. There are some things, they are just emergencies you should know. When they tell you grave disease, you know, what is grave disease?
Hyperthyroidism. Hyperthyroidism.
It is hyperthyroidism. So when they mention hyperthyroidism, I think it is okay. Is grave disease the emergency form? I think it's the emergency form of hyperthyroidism, right?
Yes.
That is it. And when you have, so good, thyroid storm. That was the word I wanted to even remember. So when they mention thyroid storm should not be treated simply as normal hyperthyroidism. So you should know all those emergencies. So knowledge also plays part. Okay. So let's say with when it comes to the cortisol aspect, and they mention Addisonian crisis, okay, or something like that, you should know that you see it's the emergency form of the normal condition. So you should understand some of these things. This general general play I'm putting before you. So as we learn everything, someone will be like, I want tricks in answering English questions and something. If you don't know what is being spoken about, you won't. Let's say this is cystic fibrosis, for instance. If you don't know what it is, and you let's say some by one way or the other, you associate it with something else, which is not it, you might get the whole thing wrong. Okay. So let's take note of that. So this one, they've limited you to only cystic fibrosis. You see, they've not opened up for you. You're not comparing conditions to another condition or situations to another situation. Everything happening here is with only one patient. So a 16-year-old patient with cystic fibrosis is admitted with increased shortness of breath and possible pneumonia. Which nursing activity is most important to include in a patient's care? So in questions like this, we've looked at some of these things before. You will see that, or you may see that everything here can be correct or might be correct. Please, we are not saying everything here is correct, but it could be possible that everything here might be correct. But have you seen the underline, the bolded parts? And I think if I remember on my English very well, I think the English also gives something similar to this. Where they want you to pay attention, they bold it for you. So if it is least something, they will write most important, they'll bold it. For you to open your eyes and see what they're asking. I think that's how it's even done on the main English. So that tells you that they want something which is most important. So use all the skills that we've gone through and see which one do you think is most important to include. Who wants to try? Dr. Jimia. Your hand is
Okay,
up.
so let me try. I'll go in for option 1 because I know that cystic fibrosis is secretion of very thick mucus in the airway. So if I perform postural drainage and chest physiotherapy, will break up the physiotherapy will break up the mucus, the very thick and sticky mucus, while the postural drainage will help to remove it, and it will open the airway for the patient to breathe well. So that's why I'm taking option A.
Okay. So Takujimi, I'll come back to you, okay? But let me see whether I can get any other person to try. Okay, Mr. Becky, your hand is up.
Yes, I was also thinking of option A, but I would go for B because this A these aerosol medications. How do I?
Yeah, I'm listening, I'm here.
Aerosol medications more or less like help with the patient's breathing. Okay. So performing postural drainage and chest physio every 4 hours as compared to the medication that can ease the patients of the plug, mucus plug within the chest and all that. I think I would have gone in for the B because in cystic fibrosis they have this mucus plug and it makes breathing quite difficult. Yeah, so in as much as the chest physiotherapy is important, I think the aerosol medication can also go a long way to help the child the patient to breathe. Yeah. So
okay, so yes, I agree with what you are saying, but I just want to ask you a follow-up question. So, oh, why from the Randy? Okay, so let's assume everything is fine. Eh? Please, I'm coming. Okay, Violet, you speak. Mr. Entry, you talk right now. I'm coming. So let's say what you're saying is correct too, but look at the other part. The question, I mean, the option says two things. So you look at it. I'll not say anything now. Look at it and come and tell me something that you've seen again. Okay.
Okay, let me
so
see.
Violet, you can talk.
So if the patient said, I don't like it.
Please come again.
Okay, for me, I would go with option C. My reason is this patient has cystic fibrosis. These are chronic condition, but she has been admitted with shortness of breath and possible pneumonia.
Yes.
So this is acute infection in a person with a chronic illness. So I would choose to place the patient in the private room to decrease the risk for further infection.
Good. I like your explanation and I like your English very, 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 very well. And Violet, you'll be my secretary, okay? And my PRO.
Okay, thank you.
Hey, yeah.
I thank you for your submission. You're welcome. I think you'll be the last person, then we see. Oh, my network has jumped again. Eh? Please, can you hear me?
Yes, better now.
Yeah, it was jamming.
Yes,
but
we
it's okay.
can.
Oh, my network. Brakojo, I think your hand was up, or you are fine now.
So like I'll go for A. So the explanation has been given. I'm confused between A and D because if the answer come out as D, but in the DD, like I would choose A. Yeah. In DD, I would choose A. But if the answer is D, I wouldn't be surprised. Because D, for the D, someone with increased shortness of breath and possible pneumonia, it means that the person's sleeping pattern is being disturbed. It's not having a good sleep. So if you plan activities to allow at least 8 hours of uninterrupted sleep, is good. But A2 is equally good because you need to perform the posterior drainage and the chest physio. Decrease the secretion. So I'm confused between A and D, but D, I will choose A.
Thank you. There's a trick here. So, Mr. Inchu, you'll be the last person. Then we look at it.
Right. I'm also going for A because I mean the other options, D, for instance. Okay, for the question, it wants us to choose which action will be most important to this client. And then the condition tells us that this patient has compromised airway. So I would do something that would give him the relief just so he could have adequate breathing. So with the other options, D, it's good to uninterruptedly allow patient to rest, but A is superior to that option. And then same as B, allow patient to decide whether she needs aerosol. So you, at this point, I mean, in acute phases, you don't allow of course, you would involve patient in decision making, but not give him or her the option to choose, because you are doing what is best at that point also for this patient. And then option C says place patient in a private room. Of course, it could be infectious, but I wouldn't prioritize isolating or reverse isolation for this patient, and then as in a first action as compared to the first answer, which is postural drainage and chest physiotherapy.
Good. Okay, so I don't know if Sister Becky, you've seen what I've circled.
Yeah, I see it.
So
I see it. I see it.
yes. Yes, so the sentences can come in two different ways. One might be correct, one aspect might be wrong, and the wrong one will negate the whole thing. Okay. So I think we've done well. We've done well. I like how even if you're able to do only 5 and we're able to analyze it quickly, at least it helps us. This one, then it's not, it doesn't help us to better our answering skills in prioritization questions alone, but how to pay attention to questions generally. There was a time where when we started, I don't know whether I should say this. Okay, let me see. There was a time we I don't know. Okay, let me see it. There's a time what we did was when people were going to write, right now it's like the workload is plenty. That is why we had some sessions. Okay, kindly mute up. Kindly mute up. We have some sessions where we go through questions and we will allow. Oh, Jacinta, you wanted to talk, yeah? Please, I'm coming. We will go through questions and we will allow people who are ready to test to choose answers and see how or what influenced them to choose their answers. Because sometimes you could see that someone might be good, but when it comes to question answering, when let's say when you ask the person to talk about cystic fibrosis, the person can say everything A to Z about cystic fibrosis and will never leave out anything. But when you ask questions on cystic fibrosis, the person will be getting it wrong. Okay, so we had that session where I mean we'll be doing questions with you and you choose the answer. Then we will see what influenced you. You are going to explain what influenced you to choose the answer, so that we know your potholes and maybe because everybody has one or two issues, like not all of us, but some people might have issues like what we are trying to go through right now. And the experience is like how we are doing it. Okay. But just that in this case, we are many, but I mean that's why I'm trying to tell everybody to participate. Look at how this one, this question is. There are a lot of issues that cystic fibrosis patients can come with, but the question has made some parts only clear. It says that a 16-year-old patient with cystic fibrosis is admitted with increased shortness of breath. You know, someone with cystic fibrosis, the person can even have reproductive problem, respiratory problem could be there, and even digestive problem. But this one, the question told you that the person is having what? Increased shortness of breath and possible pneumonia. So this is the issue that we have to solve. So everything over here should be based on solving the issue which has been mentioned. That's the first aspect. The first trick to keep in mind. So your answers should be directed towards the problem stated, not what you think should help the person with cystic fibrosis. Okay. Now let's see. Which nursing action is most important to include? So now you come to the decision. Which options among this one can help with this shortness of breath and the possible pneumonia? So you ask yourself, what is causing the shortness of breath in cystic fibrosis? That is where the knowledge comes in. You know, cystic fibrosis is all about thick secretions which are thick. So now, if I know that cystic fibrosis come with fixed equations, and in this case, the person is having shortness of breath, what can I do over here among these options to help remove that fixed equations to help resolve the shortness of breath? Lies or stays for a long time, that can lead to pneumonia. Okay, the pneumonia aspect of cystic fibrosis is because of fixed secretions staying for a long time, then they become avenue for infections to grow. Okay, that's why those things happen. So you ask yourself, is being asked. Apart from A, can you think of anything? Unless maybe you don't know what postural drainage is. But you know that postural drainage is and chest physio to help questions. Who doesn't know this? If you don't know this, you can let us know so that we give you one more 10 milk.
We didn't hear you.
So the
The
answer
line was
is
breaking.
A.
Our line is breaking.
Please, can you hear me well? For the last part or everything? Oh, Charlie. Is it for the last part or everything?
Option A, like everything you said about it.
Okay, so I said, okay, so the answer is A, but I hope you heard the explanations I gave. Why, we are choosing A, linking cystic fibrosis to shortness of breath, then to postural drainage. I think you heard all those parts, right?
Yes.
Okay, so the right answer is A. Okay, so please, you see, with how we deduce the answer, try hard and let us use to solve the next question. So you can read this, you can read through the rationale quickly so that you move on to the next and use the same guidelines to answer the next. Please try some, okay, and see. Don't think maybe you're afraid to get it wrong or something. If you don't take control of something that instills fear in you, it will end up controlling you. So those of us who fear answering questions, let us try and give it time so that we rather take control of questions. So, so there was something, okay, someone also chose C because of private room or something. So let me also give you another trick. Please, if the condition the person is having is communicable disease, something maybe airborne or droplet, please, no matter what you do, so let me go back. There's another claim. In everything, please protect yourself first. Even if the patient is dying, please, this one is always so. There is no exception. Even if the patient is dying and the patient has, let's say, an airborne disease or droplet, something that you can get some, or that can easily be transmittable to you, please, you protect yourself first before you take care of the patient. Even if the patient will die, let the patient die. I mean, that is the rule. And we are not saying intentionally let someone die. But let me give you an instance. Let's say someone with a diagnosed TB, you know the person has tuberculosis. And the patient, if let's say this patient was having shortness of breath and pneumonia, please, whether there's any option here that give the person oxygen or something to help the patient, to save the patient from dying out of shortness of breath, please, among those options, compared to isolation always comes first. Okay, so always protect yourself first before you look out for whatever danger that the patient is is taking care of, sorry, is coming with. So looking at cystic fibrosis and shortness of breath, cystic fibrosis is not communicable. Pneumonia itself is not communicable. So, I mean, there's nothing urgent here to do isolation before taking care of any other thing. So that is why isolation or keeping patients in private room doesn't take the priority here. So let's take notes. All right, let's look at this one too. A patient with acute respiratory distress syndrome is receiving oxygen by a non-rebreather mask, but arterial blood gas measurements still show poor. You would anticipate a physician order for what action? So you see, this one too is another type of prioritization, but wants you to prioritize actions. So you see another way. So this one to use the same clue. What is happening to the patient? What options do we have on the floor? Which one can't wait? You see, ask yourself all these questions and help yourself arrive at the best answer. It will help choose the right answer. Who can try? You can raise up your hand if you want to try. Okay, Brakojo, your hand is up first.
Okay, so I'll go for B.
Okay.
So the patient is having from the gases, arterial blood gas. Maybe it could be that maybe the patient is in acidotic, and then when you respiratory condition, most of these cases, if they are acidotic or mostly they are acidotic, respiratory acidosis. From what the question is saying, so the best answer would be giving the patient a CPAP.
Okay, thank you for your submission. Mr. Nchi, your hand is also up here.
Right, I'll go for A. So we are actually giving oxygen, but the means is through a rebreather mask, which we usually go with high flow, about 15 liters per minute. So for this particular case, because we said it's an acute respiratory distress, I would want to possibly intubate and then put on mechanical ventilation rather than immediately beginning continuous. So it says the CPAP is being delivered through the patient's nose and mouth. We could have some of the oxygen flow into the abdomen, which could also cause increased pressure in the abdomen and then possibly causing aspiration. So I would want
like
to
the
go for
explanations.
yeah.
Okay.
And then the C, which is lysis, has not got anything to do with this. Yes, lysis is just well, it's a diuretic, and then it could be used to treat. That's I'm not in this case. And then call a code for respiratory arrest. Patient is not in an arrest situation where you would want to create a scene. Yeah.
Okay. Gloria. I like explanation.
So I'll go for A because my
For
problem
what? A.
yes.
Okay.
My problem here is that the client is already on no rebreather max, but the saturation is so poor. So it might be that there is something going on with the upper respiratory tract that we are using. So intubation and initiating mechanical ventilation will bypass the upper part of the respiratory tract and go directly into the lung for proper oxygenation. With the CPAP, is still the same using the upper respiratory tract, which is not helping and it's still causing the poor oxygenation. With the C, That one will be after increasing the oxygenation, then you can continue with your medication. The code for respiratory arrest, that one will be done after you have done your A. Same thing.
Okay, okay. Someone wants to say something. I heard him.
I wanted to say something. With my brother who chose A. Hello?
Yeah, I can hear you.
Yeah. You see, A is saying perform endotracheal intubation. I think the thing is perform, but nurses are not supposed to do, you are not trained to do an endotracheal intubation. Except maybe you are an anesthetist or maybe you are an ICU patient who is trained to do that. You cannot do that. But if the question should have been, let's say,
Branko, please, I'm not cutting you short, but please read the second part of the question. Also, what is the next anticipation? So it's the physician's order.
The choice of words on the necklace is very important too.
Yeah. So it's just an anticipation that the physician will order for this one to be done. I mean, as to whoever would perform it, it's none of your business, but we're looking for what is best at this point in time.
Okay, very good. Very good. Etajifa, your hand was up, so you'll be the last person, then we move on, okay? Want us to cover much.
Okay, I think I'll choose A.
Okay.
Yeah.
Okay, so that's the rationale. I mean, the answer is A. Hey, who is this? Who is this? Who is this? Who is this?
Wow.
Mr. Will.
Please mute up, mute up.
Okay, so the answer is A. Okay, so so let me tell you something. Please, this one, keep it. Don't even write it somewhere before you later memorize it. For ARDS, about 90 to 95 people with ARDS, they will need intubation and mechanical ventilation. Just keep it in mind. I think I've said this in live class before. I don't know whether most of us here were here. I had it during my time, okay. ARDS, I think they were even asked, what they even asked, so it's part of, let me use this opportunity to announce this, please. Genuinely, if you want to, I want to give out some, I've selected some areas. And I want to give them out. Involve yourself. If you are here, you want to be part. After the class, kindly send me a private message, okay? All right, thank you. So what I had on ARDS was even what happens in the lungs of people with ARDS, okay? So in ARDS, the lungs are collapsed. And for that matter, gaseous exchange cannot occur. And whichever blood that is coming in are being shunted. And they move to the left side, having less or no oxygen, and moving to the left side of the heart. That is what is happening in ARDS, people. Okay. Alveoli, sorry, I said alveoli. Alveoli are collapsed. I mean, all of them are collapsed, and gaseous exchange within the sacs are not there. So you need something that could do the exchange for you, a high pressure. You know, CPAP is also good, okay? Where I was, let me say, where I was laughing small was the CPAP part where our brother said some of the air will enter into your stomach and cross. Okay, so it's when you are inspiring. You know, someone with CPAP will definitely be conscious, or maybe a bit semi-conscious, but not total, will not have a total airway collapse. Okay. Yes. When you have airway collapse or let's say a total respiratory muscle collapse, that one you need intubation.
She sat in a
So someone, hey, kindly mute up, mute up. Who are these? So you see someone with this CPAP, I mean receiving CPAP oxygenation or ventilation. It means the person, I mean, can do some respiration. And even when you are doing active respiration, I mean, when you are inspiring, or let's say when your consciousness is there, you have that flap that controls the respiratory opening and the esophageal opening. Okay.
And
So
the epiglottis.
the epiglottis. So that if the person is conscious, air cannot enter into the stomach. That place closes. Okay. And air enters into there. So that's why when you are swallowing too, at the point in time when you are swallowing, you see that you can't take a breath. You can try and see who has swallowed and taken a breath simultaneously before. You can't. So it is when you are swallowing to the flap of tissue, or the epiglottis will also close the trachea. Okay. In there, then it will open the back parts. Okay. The esophagus lies behind the trachea, and it's open the back ports for food to also pass. Unless the person has lost consciousness or something, that's where the person cannot control all those parts. So CPAP can help in some respiratory distress and rest, but just keep it like I said, in ARDS, forget. Okay, forget. None of them will help unless mechanical ventilation. So take note. Okay, take note of that.
Yes.
All right.
Well understood. But sir, can I ask a question with the CPAP itself?
Okay.
So
Yeah.
if you are giving CPAP mode and then it's through the nose and then the mouth, then what source of would I say device are they using? Is it
So you see, let me show you how the CPAP and the BiPAP mask. I'm coming. Let me show you something. I'm coming. Let me show you. I don't know if you've seen the mask before. If you've seen the mask before, we have the nose, but some are also open. Oh, what is this thing doing? Let me close this one. Let me see whether I can show you something here. So look at how the mask is. Okay.
Okay, all right. Right.
So it is the same as the BiPAP mask. CPAP, BiPAP mask is the same. The mask are the same thing. The difference between them is what the machine is doing, but the mask is the same. CPAP is continuous positive airway pressure. So the pressure is only one way and continuous. Okay. But BiPAP is like as the name implies, bi-level positive airway pressure. Okay, so it sends in and it pulls out. Okay, it controls both inspiration and expiration. But CPAP is only one way inspiration alone.
All right, thank you. I had not seen this mask before, so I was just wondering how that would be done. That's why I had to say that rubbish physiology. Sorry about that. Now that I've seen the mask.
No problem. Okay, so let's look at this one too. The office nurse receives 4 telephone messages from clients. So which one should the nurse call back first? This one too, let's take our time. Yes, who wants to try? Okay, let's see. We have two hands here. Mr. Entry, the first one before Jifa. Please, you can mute up
Oh,
and you can unmute.
my hand
It's an
hasn't been up. Oh, sorry.
Oh, okay. Okay,
But
Sister Jifa, let's
I
go.
could go with the an option anyway. Okay, so Sister Jifa first, please.
Yeah, Sister Jifa, come. Or
Okay,
it's also an old end.
I think I'll choose one. Because
Okay.
I think the boy, I think he's gone to the woods, so maybe there could be some like anaphylactic reaction going on. That's what I think.
Okay. All
One is
right,
Lyme
thank you.
disease.
Okay, who else wants to try? Quickly.
Go for it. Go for it.
I'm going for three.
Hey, please,
Oh.
please raise up your hand. Raise up your hand. Let me see. So that I can call you. Okay. Okay, Mr. Inchi, your hand is up.
Right, so I'm going for three. A
Okay.
78-year-old prescribed warfarin who reports increasing headaches and gait disturbance after falling a month ago. So, a month ago. Okay, well, so this is an active thing. And warfarin is supposed to reduce the thickness of, or it's a blood thinner. So taking blood thinner should not come with these signs and symptoms, and it's also an active thing which needs to be looked into. And that's the reason I would go for that one.
Okay.
I stand to be
All right.
corrected, please.
All right. So I think we should.
Okay.
Okay.
So let me come in if this could help my brother.
You didn't raise up your hand. Okay, you go ahead.
No, because of what he said.
Okay.
Yeah. Just adding something to his point. Okay. I think this is a case whereby we are suspecting a possible intracranial bleed because the patient is already on warfarin, and then this patient has fallen and then is complaining of dizziness and headache and gait disturbances. So the patient might be having a possible intracranial bleed because of the blood thinner the patient is taking. So that's why this answer should be given a priority.
Right, thank you. I mean, you've enlightened me. Thank you.
Okay. All right. So, Madam Mercy, then Sister Joa, then let's do it quickly.
Hello, good evening. So
Good
I'm
evening.
trying. I think
Try.
I'll go for one. The bull's eye rash shape is Lyme disease related, and this person has had I would say, a stink from probably the insect that causes Lyme disease. The name is too big for me to mention. So and so I think if care is not taken, it can maybe result in a form of anaphylactic shock or something. That's why I'm going for that. Although the person walked in the woods about 2 days ago, but is now reporting that ring-like bull's-eye shaped symptom. Thank you.
Okay, so wait, Mr. Entry, what do you choose?
3, please.
Madam Mercy.
Hello.
What do you choose right now?
I chose 1.
1, okay. I think we have only 2 people here. Then that's all. Okay. So between 3 and 1. Okay, so let's see 1. 20-year-old college student who report getting ring-like red bruise rash, itchy. So this one, you are right. This one is Lyme disease. But let's look at something. Is there anything emergent about these symptoms that these patients with Lyme disease is having? Is there anything emergent happening right now?
No.
Yes, so I don't think this one should be prioritized. I don't think there's anything here, you see. So we're able to remove 2 and 4. So let me concentrate on 1 and 3. So look at 3. 78-year-old who has been prescribed with warfarin. So the person is taking warfarin. That's what it means. And the person reports what increasing headache and gait disturbance. After falling, the person even fell. So just imagine, warfarin is an anticoagulant, and the person fell. Look at the age too. Though age is not a factor, but when it comes to fall, you have to look at the age. When a 30-year-old person, it depends on the extent of fall, though, but older adults, they have this tendency of falling. You know how frail they are, their body and everything. So this person has been taking warfarin. The person had a fall, and now the person is reporting increasing. Look at this word, increasing headaches. It can only tell you that the person is bleeding in the head. So this one should be easily spotted. Please, do you all agree?
Yes.
Simple. Okay.
Yes, boss.
All right. Okay, so I think this is the rationale. Just a few seconds, then we move on to the next thing, see what we have. Can we move on? Okay, let's look at this one too. So the nurse on the medical unit finishes receiving the change of shift hand-off report at 7:30 a.m. So which assignment think around the question exactly as it is? Who wants to try first? Hello, who wants to try? Is it difficult?
No.
Then try. Be the first person to try for us. Laku. Is it Laku or how do you pronounce it?
Laku.
Laku, okay. Can you try for us?
Okay, so I'm going for the option 3. Why option 3? Because option 1 has gastrointestinal bleed and is already receiving a pack of red blood cell. So management is being done. It's ongoing. And then with the option 2, client has ulcerative colitis, flare up, and then temperature is expected to be high, coupled with abdominal cramping. And then when it comes to the option 4, chronic kidney disease, he's already scheduled for dialysis at 7:30 a.m. Okay. There is a 30-minute period. serum creatinine is expected to be high. So 8.4 is already going for hemodialysis, so that's not a problem. It's not really an emergency. But with the atrial fibrillation, somebody with atrial fibrillation is an emergency. He's on ECG monitoring, and he's being prescribed warfarin. You need to monitor him for some time period and see if there will be a change in the reading before you can move away from such a patient. So that's the reason why I'm going in for the atrial fibrillation client who is on treatment, and they are monitoring the INR while taking the warfarin.
Lako, I like how your explanation is okay. I like it seriously, but let me ask you a question. I want to use your own words. You said someone with atrial fibrillation. Exactly how the question said, right? So what makes the option 3 you chose becomes the most emergent? What's in there? I want you to point it out.
Okay, so the abnormal
is it the condition itself?
Is the
abnormal
no, is the
what?
abnormal heart rhythm the patient is exhibiting. That makes it.
Wait. Did they say the person has abnormal heart rhythm?
Is the INR?
Is the INR?
Okay, so what INR should you expect for someone on atrial fibrillation?
0.8 to 1.1, I think.
No, that is the normal one. But this one, the person is on warfarin, so you expect the therapeutic one. So what's the therapeutic range?
2 to 3.5, if I'm not mistaken.
2 to 3.5.
I think it's a 2 to 2, no, 1.8 to 2.5, I think.
No. Okay, so
it's 2 to 3. It's 2 to 3.
Okay, so the therapeutic range is 2 to 3, at least for people who have clotting issues. But from 2, listen to this very well, but from 2 to 3.5 for people with mechanical heart valves. So look at the difference. When they give you a question and the person has a mechanical heart valve, when you get an INR value, if the person is on anticoagulant and you get an INR value of 3.5, please, it is okay perfectly. Okay. I'm repeating myself again. When a person has something implantable within the heart, like the person has undergone maybe valvuloplasty with maybe an artificial mechanical heart valve, please, an INR of 3.5 is accepted. It is when it gets over 3.5 that you don't want. So even if this one we expect 2 to 3, Shafao, kindly meet up. Even if we expect between 2 to 3, you know that 3.2, though it's a bit elevated for someone with atrial fibrillation, but it is not any big issue. That's why I was asking whether, it is, I mean, Mr. Lako, right? That's why I was asking whether it is this one which makes it emergent or which one. I wanted to know your reason for choosing, but at least we all agree that this one is just a bit 0.2 elevated, though, because we expect a therapeutic range of 2 to 3. Please, those who joined us recently, don't worry, you'll get there. They are on your schedules, okay? And when you get there, you do it. You see all that we are talking about. So,
all right, thank you.
So this one, you remember that I said even if you're having a mechanical device in there, we even expect 2 to 3.5. So if it is atrial fibrillation, yes, it is just 0.2 elevated, but is it emergent? So let's see, fine, during taking up, I want you to sometimes have it in your case scenario. During taking up, I want to speed it up, so I'll not take any other option again. Let's say during taking up, you have an INR value of this for someone with atrial fibrillation on telemetry, taking warfarin, INR of this. So then you have someone who is currently receiving blood. Between these two, the blood is ongoing, which one, like in your case scenario, which one will you go and see first?
I'll see the blood because it's supposed to be monitored at least every 15 minutes for reaction.
You see that thing? It says, you see how option one has been written. I'm sure this is the first option you even throw away before you come and look at the rest. Am I not lying? Someone threw it away first. So it's like you've thrown the good answer away. Then I come to fight among the wrong answers. You see how sometimes English can treat some of us. It happens to everyone. Okay. So this one is not any issue. This one is not an issue. So let's say for me, I chose this one. Okay, I choose this one. And this one, like we said, maybe this one can let you choose it, but it's not any big issue compared to this one. So you should see this one first. And please, what you should always see first doesn't mean that it should always be something abnormal. Also have it in mind, okay? Not that, or it's always that something is already abnormal that you should pay attention to. Okay, yeah, so I think there's the answer. Let's go through quickly, then see if we can take the last one before we go.
Please, I'm confused. You take the lots of answers. So which one is the answer, please?
The answer is one. Can you see your screen? Can you see your screen right now?
Yes,
okay.
Please.
All right. So I think we should continue. Let's take the last one. So the nurse is planning to assess 4 assigned clients. Which client situation is of greatest concern and warrants immediate assessment? This one should be our last bonus question to take home. Hey, there's another. Wait, let me see. After this one, let me see the next question. I wanted you to see one particular question before. Who wants to answer? Let's try. Just one person, then we'll go. Let's see the person who raised the hand first. Okay, it's Emilia.
I'll go for 2.
You go for 2, eh?
Yeah.
Okay. Because of time, let me put the rationale somewhere. Okay. But thank you. It's an Effie.
Hello, please, I'll go for 4.
2 and 4. Wow. Wow. Let me see. I think there's another one. So, Takujimia, what will be your answer?
I'll go for 4.
You go for 4. What is happening in 4?
The client has risk of peritonitis, rupture.
So what do you think has happened?
And
it has ruptured.
Okay. Okay.
It's probably
Strangulation.
Maybe strangulation because they say hernia.
Yes.
Yes, strangulation. Thank you.
So fine, inguinal hernia strangulation. Then someone said 2, taking diphenhydramine for urticaria. What class of drug is this one, diphenhydramine? What kind of class?
Antihistamine.
Antihistamine, yeah, or maybe it has anticholinergic properties too, but I think it's antihistamine more. Okay, so for urticaria, we give this medication to someone with urticaria. It helps to resolve this urticaria, who reports difficulty urinating,
Antihistamine.
who someone should mute.
Ready.
Mr. Enchu, we can hear you. Nasiano. Okay. So client taking diphenhydramine for urticaria, who reports difficulty. Yes, so an increase in lower abdominal pain. Okay, so fine. These ones cause they can cause, you see, they are antihistamines, but they have anticholinergic properties too, especially for this drug. So a drug that has anticholinergic property, they will not allow you to pee. So you can think of this acronym. I can't pee, I can't poo, what is it? I can't cry. I can't pee, I can't cry, I can't do what? I can't drool. Okay. It's like they dry up situations, and I can't poo. They are all parts, right? Yeah. So what is happening here shows that the person is having side effects of this drug. Just a side effect, not anything bigger. That's why they mentioned this drug here. And this one is strangulated inguinal hernia. So between this one, I don't know. So did someone choose 3? I don't think so. And I don't think someone chose 1, right? So answers are between 2 and 4. So these ones are side effects of the drug. But strangulated inguinal hernia, strangulation, any strangulated hernia is what? It's an emergency. So 4 will take over 2. So the answer is 4. Let me see whether we can. I think this is the question. Please, if you have time, just give me 1 minute of your time. Let this one be your last question. Then we move on. Okay, so the nurse assesses 4 children in the clinic. Which assessment finding requires?
I didn't see the rationale, the answer.
Oh, you want to look at the rationale? Okay.
Yeah.
Sorry. So a few seconds. Then we take our last question. Just last question.
Please, I'm done. Thank you.
Okay, you're welcome. So let's look at this. The nurse assesses 4 children in the clinic. So they are all children. So which assessment finding requires the nurse's priority action? Take home. Okay, Takujimia.
Yes, I'll go in for option 1 because I'm seeing fever here, vomiting, high pitched cry is a hallmark sign for meningitis. So I'm suspecting that already.
Okay,
so, yeah.
okay. I like how you deduced it. Any other person? Okay. Sister Mercy.
Okay.
Hello. So I'll go for 2 because this child is having diarrhea and looking at it, refusing food, cries without tears. So that means the child is severely dehydrated.
Okay, good. Yes. I like it. So right now we have dehydration and what? Meningitis, right? But with irritability, there's something to, but let us take it like that. Okay, it's Emilia.
That's what I want to talk about.
Okay, you can raise up your hand and talk. I'm
It's
calling
likely
those
the
who
client is suffering from
Yeah,
a
I wanted
neurological
to talk
disorder.
about.
So meningitis.
wait, let us go by those who sense are up. Okay. So Sister Emilia, you said what?
And I was also coming to talk about the areas that lead to diet,
Okay.
maybe having effect on the brain.
On the brain.
I'll go for
Okay.
one.
Okay. Okay. Please, was there anyone who was choosing a different answer? Or we all rest our cases? Okay, yes. So the answer is one. Okay. Between dehydration. Dehydration, when you prioritize according to ABC, it's circulation though. But this one, the brain is directly involved. Brain over circulation. So it's like brain over heart. When prioritizing, you prioritize what? The brain. Let's look at the rationale and understand more. Are you all okay? Okay. So I think that will be all then. We can take a screenshot of this one. Take a screenshot of this. And you can try and send me the answer privately. I'll send you the rationale. And you can mark yourself. So we will end here. Can I close my screen now?